When they say business as usual, they don't really have a choice. They have to meet that demand, and that's where we're trying to innovate to help them.
There are new needs that we all have, and they may not be a forever need. And I think that's where the uniqueness of what Medaxium has put together to be able to help us move forward and help us better serve our communities and have the right skill sets at the right time.
When it comes to cardiovascular care on the organizational level, Medaxium understands the challenges your program is facing. Welcome to MedAxiom HeartTalk, the podcast where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
I'm Melanie Lawson, a journalist in Jacksonville, Florida, and host of MedAxiom HeartTalk. I am excited to introduce today's topic: interim staffing. It's on the rise right now. So what does this mean for your program? Today's guests are Joel Sauer, joining us from Fort Wayne, Indiana, and we also have Chris Lipp in York, Pennsylvania. Joel is Executive Vice President of Medaxium Consulting. He has more than a decade of national consultative services under his belt. He has helped cardiovascular organizations accelerate the transition to value, creating contemporary and effective physician-hospital partnership structures, sometimes utilizing integration or contractual and organizational arrangements. His work has included full service line development, governance, and leadership development, and targeted co-management programs. Now, let's talk about Chris Lipp. He is a registered nurse and has a Master's of Health Services in Administration, the Vice President for Heart and Vascular Services, and also Interim Vice President for Surgical Services at WellSpan Health. WellSpan Health is a large integrated health system with 20,000 employees that serves South Central Pennsylvania. So welcome to the podcast, both Joel and Chris.
Thank you. Glad to be here.
Thanks for having us.
All right. So I want to ask you the first question that we tend to ask all Heart Talk guests. Why did you decide to get into healthcare? And did you ever have that aha moment? Joel, let's start with you.
Yeah, I wish I had a better story for this, but my entry into healthcare was more out of necessity. I had graduated college and was living in a college town, which was flush with young talent who would work for next to nothing. And my wife was still finishing school, so we were committed to the community for a while. And I had a friend say, hey, the company I'm working for is hiring, and they happen to be a software developer in the healthcare space. So I applied, got the job, and spent the next now 30 plus years in healthcare. Mm-hmm. So that was my entry into it. I wish I could say I was, born to do this and had thought of it my whole career. I hadn't, but the more I was into it, the more wedded I became to the profession, and feel like it was a great choice now, retrospectively.
Joel, sometimes those moments aren't earth-shattering. They just happen. And clearly you're right where you need to be.
I call it Forrest Gumping. I Forrest Gump my way into healthcare.
Hey, it's working for you. More than 30 years, you're in good shape. All right, Chris, same question to you. How did you get into healthcare, and what was your aha moment if you had one?
Great question. My aha moment was when I was in high school and realized I needed to pick a major going into college. And I really enjoyed helping people. I loved business. I liked chemistry. I liked the sciences. And I started down this path and realized nursing would allow me the opportunity to grow and develop and take care of people. And most importantly, travel and get to see the world, which I did a lot of in my early 20s. And once I got into my nursing field, I just kept getting opportunities to do new and challenging things. You'd see a problem, you'd raise your hand and say, how come this isn't working? Or boy, this patient didn't get the care we could have given them. And next thing you know, you're on a committee, and next thing you know, you're on another committee, and next thing you know, you're doing this at more than one organization, and you find yourself getting your master's in health services administration, and it just becomes a career path. And loved every minute of it, and been very fortunate to get to work with really talented people, both inside the organization and outside. And Joel's one of them. He's a partner and has been for what now, Joel? We've known each other for over a decade.
It's been a long time.
Yeah.
And you have such a better story, by the way.
I like them both. I think they're both unique. And I love it because it sounds like you found your purpose and you've really been able to combine your passion as well. And I think that's what helps us all be so successful. All right, Joel, I'm going to pitch this first question over to you. According to a recent Medaxium survey, despite the pandemic and other pressures that we've all experienced over the last more than a year now, 41% of cardiovascular programs said their 2021 hiring plans are just business as usual. So what are the implications? And were you surprised by these results? And what does it mean for staffing moving forward?
Yeah, great question. And this was from a member survey that we do regularly. You know, we try to keep our finger on the pulse of our membership so that we can be the best member organization that we can be. And I would have to say I'm not surprised because, you know, we put the world on hold for a while because of the pandemic, and heart disease didn't stop just because people were staying home and putting masks on and being safer. And in fact, when you look at the data, the United States is aging quite rapidly. And when, you know, it just kind of goes hand in glove, the older a person gets, the more likely they are to develop heart disease. So we're looking at dual trends of increased demand for our cardiovascular services. At the same time, we are unfortunately not turning out enough physicians to keep up with that demand. And that's pretty much been validated by multiple studies and organizations across all sorts of different vantage points. So those dual forces are pressuring our provider community tremendously. So when they say business as usual, they don't really have a choice. They have to meet that demand, and that's where we're trying to innovate to help them. So many programs are heavily reliant on that interim and transient workforce now, out of necessity.
Yeah, and it sounds like the trend is just going to continue, if not even expand. You know, Chris, let me ask you, because I understand that you recently collaborated with Medaxium and the team around interim staffing. What was that experience like for you?
You know, before I answer that question, I'd like to go back to the comment that Joel just made, or what the survey results showed. So yes, day-to-day staffing, I would say we are, at least from our vantage point, we are seeing that. But as I talk to my peers across the country, it is business as usual. But we are beginning to recognize in the field that there are new needs that we all have, and they may not be a forever need. So we might need some assistance on understanding the transition to value, or we might have a need for a specific niche knowledge set to make a transition or to help us adjust to business as usual. So I think there's some nuances in business as usual skill set knowledge workers, finding people to work in your space to treat the communities that we're all here to serve. And I think that's where the uniqueness of what Medaxium has put together and what we've used as a health system in partnering with Medaxium to be able to help us move forward and help us better serve our communities and have the right skill sets at the right time to care for our populations and get our team members up to speed and ready to go in whatever current paradigm or our future paradigm. So to answer your specific question, mm-hmm. what did we find? How this all transitioned is we had a need. We recognized we had a need at one of our facilities for a interim leader that had a very specific skill set to improve the outcomes of our cath lab, to increase to be able to bring the right staff members in, to be able to improve the quality and outcomes of the care that we're providing. And it was fantastic. I picked up the phone, I called Joel and said, do you have any references for a organization that we can use, maybe a search firm? And he said, well, what about us? And said, absolutely, we'd be happy to work with you. Tell us how this works. What are your terms? How does it? And within a day, we had everything in our inbox. And within a week, we had people in the midst of the pandemic on site, touring, seeing our facility, making sure it was a match, meeting our physicians and our clinical teams. And we met with a couple of the folks that they sourced for us. And we found a really good candidate. In fact, that candidate is still working with us and moving our program in the right direction at that site.
Wow, it's a perfect match, it sounds like. Medaxium, the team really helped, using this kind of unconventional strategy, just picked up the phone and kind of made it happen. So talk about Medaxium's talent solutions. How did it come about? How does the process work exactly? And I love, Chris's point that there's an opportunity now to kind of pivot and address some things that maybe weren't even on the radar before.
Yeah. So over the years, we have been approached by our members intermittently about, hey, we have this gap. We have someone, sometimes or often long-term, who either retired or left and took another position. And now we have this gap. It's going to take us a while to fill it, but we really don't want to go that whole time without somebody in the position. So can you help us out? And when we could, the consultants would try to fill that need. But, after you got asked a couple times, you were like, I wonder if this is something that could be, because these were all unsolicited. We didn't go do any marketing or try to build that. We were just reacting. And the leadership inside Medaxium kind of talked about it. And we decided, there's enough here that we should probably look into this as something our membership needs and that we could do a great job of filling. So we did the analyses, we did the homework, and then we determined it is a different skill set than what we internally possess, but that we want to maintain this absolute high level of concierge level service to our members. And we didn't feel like we could get that if we just said, hey, Chris, go talk to Acme staffing. They're, we've talked to them and they're good people. We wanted something much deeper than that. So we reached out and developed a relationship with a company called Roundtable Strategic Solutions, or RTSS. And we brought them into and formally created an alliance with them so that they are Medaxium for all intents and purposes when we are putting something together. And we found that they shared the passion for this concierge level of service to their clients and to their talent, to the people they hire. And we found that just very, very in sync with our culture and what we wanted to achieve organizationally. So it was kind of a match made in heaven. Medaxium Talent Solutions was born from that. And that's that launched right around the time Chris reached out. So there was serendipity there as well.
This was the way this was handled was very different than I think if you went to Acme Talent Solutions, right? You get those other talent solutions give very broad-based questions. They need to be people person. Do they need to be? You guys kind of skip that. Like, what a cath lab leader needs. Now, what are those very, very, very specific questions that you want to know? Do they need to really know compliance? Is there issues with physician relations? So you went through those specific things, you listed those out as a priority. And actually, what's nice about this experience is you guys put it into a weekly summary. So we know where the hours are spent by this leader or this interim staff member. We know what they're working on. We know what their outcomes are. We know every nuance of the work that they're doing. And are we hitting those goals? Are we not hitting those goals? Or maybe they shouldn't have been the goals because our assessment up front wasn't in detail, or maybe there's been a change in staffing, or there's been a change in what our real need is as we go through the process of having an interim leader. So I think that's a very value add component that maybe you don't get from every Acme Solutions, as you said, Joel. But we've been very happy with this interim leadership solution. I think if we had a need in the future, we'll go back and use it again.
Wow, Chris, that really made life easier for you all. I love the idea, again, that we're pivoting and that we're reacting. And as a resource, time is of the essence. You're talking about patience. And, I feel like just as quickly as we all went home and stopped going anywhere, we have now decided we're back. And like you said, cardiovascular disease didn't go anywhere. And we have to be able to treat these patients and treat them well.
So you bring up a really good point, which is the pandemic. We started this exploration well before the pandemic. And, the gig economy, that the temporary gigs like consultants, that was on the rise before the pandemic hit, but the pandemic just exploded it, because now the virtual world has become street. It has become very commonplace. It used to be kind of a, out there cutting edge thing. Now it's absolutely a staple of every industry. So if anything, the pandemic just increased the demand for this kind of gap coverage and talent.
Yeah, I mean, and you said everything, because we see it in restaurants, we're seeing it in stores, and obviously in healthcare as well. All right, we have a good discussion going. So I do want to give a quick note to listeners. You might be asking, where are we getting all these statistics that we are mentioning in today's episode? You can download that full interim staffing solutions survey report at medaxiom.com/talent solutions. You'll find it under CV Talent Trends. A lot of valuable information there that we may not have time to cover today. So if you want to unpack that, definitely go check that out. So Joel and Chris, we've talked about your specific experiences with interim staffing. Now let's really take a look at the bigger picture. There's a recent article from Small Biz Genius that says if the gig economy keeps growing at its current rate, more than 50% of the workforce will participate in it by the year 2027, which we all know will be here before we know it. So Chris, thinking big picture advice for your peers, how do you think this type of arrangement ultimately helps out an organization?
Again, another great question. It helps organizations in many regards. I think the first thing that it does is it allows us to go out and find experts in specific niche areas and niche fields that allow us to accelerate our rate of change, garner very specific talent pools. And it also helps us staff interim needs. These are very important things in healthcare that we might be a little bit slow to adapt to. And I think we all need to be planning for as we move into the future.
And Joel, 50% of programs would consider using interim staffing or project teams. And as we hear, this isn't changing. The trend is going to continue. Their top 3 project priorities being 1, specialty clinic development, 2, access improvement, and then 3, staffing efficiency opportunities. So is this consistent with what you're actually experiencing and what your team is seeing?
Yeah, it is. And I want to go back and just say what a great answer, Chris. I think that was spot on. I think, healthcare has sometimes lagged other industries in some of the adoption of efficiencies and things like that. And I see the gig economy and, to those particular 3 that you just referenced from the survey, those 3 priorities. Not everybody in an organization has the skill set to develop a specialty clinic. But then when you don't stop needing that skill set, what do you do with that person? And so bringing someone in on an interim basis or on a project basis and saying, help us do this. Once you help establish it, we can maintain it. And then that person goes to the next one and the next one. And what you're doing then is you're doing a much better job of matching the expense to the need, which we're all going to be forced to do in our industry because the dollars are just drying up. By most of the governmental calculations, Medicare will be insolvent in approximately 5 years or less. So we have to figure out a way to reduce the cost of the delivery of healthcare. And I think the gig economy, used smartly and I will add ethically, because there would be a real nice way to abuse employees through this or abuse the workforce. And I don't think any of us want to do that. I think that to be done right, though, there is a real opportunity for us to bring down the cost of the services we deliver. Because even though we have very strong demand, it isn't consistent demand. It ebbs and flows, and yet our expense structures tend to stay very static. And healthcare is trying to learn to have it modulate with the demand. And I think the gig economy fits perfectly into that scenario.
I think if there's anything that we've learned over the last year is that we really do have to be flexible and be prepared for any and everything. And I think this really does address the need to make sure that you have the proper staff when you need it.
There might be a gig economy figuring out how to use the gig economy in healthcare.
Right? Hey, there you go.
If they're not our children yet, Chris, yours are a little young, but they're probably going to work on that.
Yeah. I think we should know Chris has a 1-year-old and a 10-year-old in the house and 2 in between. So he's a busy guy right now. So we certainly appreciate you giving us your time. And then Joel is a proud grandpa as well. So thank you all so much for sharing your time and your expertise today on MedAxiom HeartTalk. Well, that is it for this episode. If you liked it, please tell your colleagues and let them know that they can subscribe to MedAxiom HeartTalk on Apple, Google, or wherever they get their podcast. Also, if you'd like to send us a note directly or even suggest a topic, email us at hearttalk@medaxiom.com.